Good afternoon, everyone. And thank you so much for a nice introduction. So I got sore throat. Maybe my voice may not be that clear, so I'll try to go a bit slower. So today I'm going to talk about federated learning in healthcare. So I am the lead of multimodal learning lab, which is a cross-border lab in Aberdeen and Nepal. So our focus is on developing novel machine learning algorithm, or in particular multimodal learning algorithm from both real and synthetic data. And we develop such algorithms to interpret and reason. So my lab's application is extended from computer vision, medical image analysis, and energy. So I'm grateful to some of the generous funders. Right. So I go with basic first, and my talk can be a bit technical for the people with background in only background in clinical side, but I'll try to go normalize this technicality. So machine learning, what is machine learning? Let's start from here. So on the left-hand side, you can see the symbolic picture of machine learning, and on the right-hand side, it's a simplified version of machine learning. So, but where does this machine learning actually stands is maybe in between them. So the fact is that what machine learning does is, in a simple term, it's a technique to teach computers to learn from data and make decisions. So there are various types of machine learning, right? So one of them is called discriminative models. So discriminative model means given the data, so the data can be in the form of some images or text or time series. And this kind of model, what it does is it predicts the category. So it can be disease category, or the pixels on the image. Let's say you can see there on the image on the left-hand side. So that's an image, GI image from endoscope. So it also predicts where these polyps are, right, the pixels. And generative model means it generates the data in simple terms. So you must have heard about or also used the ChatGPT. So it's a generative model. So it generates the text, okay? So right-hand side, there is a model developed by Microsoft, which is called Myra. So given the image, it describes the pathology or the other aspects. So there is something called deep learning. So how many of you haven't heard about the deep learning here yet? Haven't heard? Haven't heard? I'm sorry. Haven't heard, because many of you have already heard about it, right? So it's so popular now. I mean, it's a kind of buzzword, or it's popular in every domain, right? So what does this deep learning is then? So there is something called artificial intelligence. It is like physics or chemistry, a kind of discipline, right? So the deep learning is, then machine learning comes there, then deep learning is a type of machine learning. And the generative learning is, generative AI is a type of deep tech, okay? So this has been widely been used in various applications, including healthcare, and it has shown a lot of promises. But what are the challenges now, So the challenges is it's voracious. It takes large amount of data. How large? I'll show you a slide here, okay? So in the talk of presentation related to healthcare, I'm showing something on slide related to face analysis, on which I used to work for many years. Why I am showing this slide here is that because this is one of the most extensively studied domain in AI, right? So I actually keep track of this data size, and I put this 2012 as a year to split between two sides. Why? It's because the mainstream deep learning architecture was introduced that year, okay, which is commonly known as AlexNet. So if you look into these two sides, you can see the size of the data that is being used or proposed to train a model. Okay, so I was keeping track of this till 2021, but then I stopped it because now it's something very big, you know. So like 260 millions of images or billions of tokens are being used, right? So this is the something that this size of data, this amount of data is being used in computer vision or NLP. But what is the situation or scenario in healthcare? Okay, so if you look into this slide here, right, so this is a data set, different data set for GI tract or colonoscopic data set collected in different centers. So now see here, the number has come all the down from few hundred millions to few hundreds. So the thing is that, so are we able to train a model, deep learning model with this amount of data? So we can do that, but maybe the model may not be optimal, right? And also, the sharing the data, like for example, on internet, we share our pictures, family-related photos, and we write about the blog and everything. But we are not going to share the data about our GI tract or colons, the images taken by endoscopes, right? And also, meaning like these data are not readily available. So they are there in the hospital or in the research centers, and also these hospital and research centers, they cannot readily share because they are very privacy sensitive and they need to protect the privacy, right? So now, okay, so there are, for example, let's take an example here in Kathmandu as well. There are multiple hospitals, many people, the patient's records are there, but due to privacy issue, we can't share them readily, okay? And then there are certain hospitals, many hospitals outside the valley as well. They also collect the data, right? But since we cannot bring the data into our center, then is there a way we can use to train a model without sharing the data? The data remains in the same center, but still be able to share the experience, and with those experiences, the outcome would be a robust model. And that's what it is called federated learning here. So the federation, the distributed, right? So in simple terms, federated learning is a paradigm that enables learning without sharing the data. So the data, you own the data, like here there are several clients here, so Institute 1, 2, 3, 4, so these are the separate, the different institutions. So these institutions, they own their own data and they train a model locally in their machine, right? And now these models are being shared to a common server, okay? And these models are aggregated in a way that when they are shared back to the clients, every client gets benefited, okay? So that's what it is, federated learning is. So how does this federated learning compares with others? So one is standalone, meaning like you have your own data, you don't share with anyone, you train your model, but the model may not perform that well. And another approach can be like the aggregation of the data, like creating a data lake, meaning you ship the data from your institution to a common server and then train a model. But the problem with that approach is basically you don't protect the privacy of the patients because you are not allowed to migrate the data of patients from your institution to another institution, right? So compared to these two, the federated learning actually only shares the model. So the models are like weights or the number of matrices there. So these are numbers and these are not interpretable, okay? So then even if you share that model, so you can't disclose the information of the patients. So in general, the advantage of federated learning is, it will give us an opportunity to, get the experience or the learning from large amount of data, right? And it also mitigate collection and feature bias because the bias can be created. For example, there is a hospital where there is a certain ethnic group of population is there, right? So then training a model only with those data may not necessarily generalize with the patients from different ethnic group, right? So that kind of thing also can be mitigated with federated learning, better models, good performance, privacy, and reduce compliance burden. I mean, if the system does not disclose the information of the patients, then maybe, the compliance burden can also go less. Right, so this is a comparison between this technique, standalone, federated, and federated learning on different attributes. So the red means the disadvantage, and the green means the advantage of this technique. So what I can say here is that, so the federated learning comes with the several advantages in different attributes here. Right, okay, so I talked so much about federated learning, good things about the federated learning, but definitely there are the challenges, right, to adapt and develop such technology. So what are those challenges are? One of them is data heterogeneity, meaning like data collected in an institution may substantially differ with this data collected in different institutions, because it can vary with, the skill set of the technicians, they collect the data, or the ethnicity of the people, or the instruments they use, right? And there can be distribution shift. So shift, that means nature of data is different due to variability in data acquisition. And third point is communication overhead, meaning you train a model and they are already large model, and sharing those model every time in the server also comes with computational burden. And there is also still security risk, right? Because there are several attacks that can be done on these model parameters. Moving on, I will take example of some of the representative clinical use cases and how this has been, that we apply in our lab using federated learning. So one of them is polyp detection. So I think whoever is has a background in clinical background, so they must be knowing it very well. So the polyps are like small growths on the wall of intestine and colons, right? So this detection of the colon polyp in early detection can actually be very crucial to prevent from colorectal cancer. And so, for example, the study has shown that early detection increases survival rate from 10 to 15% to 60 to 80%. So meaning if we can detect it early, then we can save the life of a patient. And there is also a study that, endoscopists may miss up to 30% of the detectable polyps. So maybe here, the use of AI can be there to detect the polyps and, early detection and prevent the patients from, save their life. Right, so as I said, the challenge is distribution shift. Here, these are the examples from the data collected from 4 different institutions in Europe. So this CADe is from Norway, similarly Indo-UTA, Oxford, and so and so. So if we look into these images, we can see a clear distinction between the quality of these images. So meaning, if I just rely on a model to train a model, even in a federated manner, and simply come up with an aggregation in a simple manner, then the model may not help us. Instead, it may distort, because the quality, there is a distribution shift in the data, right? So, to tackle such problem in federated learning, we investigated some method called cross-domain deep federated learning. So I'm not going to go into the details here, but the idea here is that, there is common parameters and there are the unique parameters from the client. And we came up with a novel idea to align these features, because there is a distribution, the nature of data is different. So we came up with the idea to align into a common ground and then aggregate. And that actually helped us to improve the performance. So the numbers here may not make a lot of sense to everyone here, but the number it says is the bold means the better, right? The higher performance, higher the number, the better it is. So our method was actually better than the several the competitive methods. Right, so I also mentioned there in the beginning, like what are the challenges in federated learning is, one of them is that the model, because these are deep network, they have like millions of parameters, right? So deep network, like sharing and uploading to the server, right? We need some dedicated infrastructures, and that's computationally intensive. So we also came up with some novel ideas to, prune certain parameters, removing the redundant parameters from this deep network and come up with a small version of it without losing the much performance. So I'd like to show you a video here. So you can see that there are the images from columns, and the middle one is the original model, means like the deep network, and the right one is our pruned, like a small size network. So if you compare the performance, meaning like the green area, the detection of polyps, it has not degraded much, but we reduce the parameters by large margin. So that makes the thing efficient to share the parameters here. So these are basically marked by AI algorithms, okay? So is it going to be useful for you, like the clinicians or endoscopists, if you get this kind of tool and can make your life easy? So then maybe we should discuss about it. Right. Okay, so then another thing that we work on is retinal disease diagnosis. So OCT is an image technique for capturing the images. And the task is to, given these images, how we can predict one of the four, let's say, categories, right? So, but the challenge with this, I'm taking this example as a reference, but this is the actual challenge, okay? So if you see the number of data sample in each institution, so these are collected in different institutions in the UK. So there is NHS, there is UCL, and Pharma Enable, and Moorfields, okay? And then if you see the distribution of the diseases here, there actually is, this is varied, meaning like there is not the same number of patients, or the ratio of the patients in an institution is different than in the other institutions, okay? So then simply aggregating them, the model is not a good idea, okay, in this case, even if we do federated learning, okay? So in this case, we employed our noble technique, so I'm not going into the details again here, and that actually helped, and then train in a federated manner, and that actually helped us to get very good performance here. So fed average, this is the technique that we did, and federated LEC means if you have this chance to bring all the data in a center and train a model, okay? And the others are like, the data, Moorfields, Pharma Enable, means this is the performance of the model trained on their own data only, okay? So meaning we can clearly see the performance gap. So the federated learning is bringing the advantage here with the improved performance, okay? Right. So another use case that I would like to discuss here is on the chest X-ray anomaly detection. And here we try to address this problem of multimodal learning, right? So with the advancement in the different modern, the medical devices, so there are different types of devices are being used, and they are actually recording the various aspects of patients, right? For example, I'm wearing this watch and it's recording everything, like how many, the respiration rate or blood, so and so, right? So it means this kind of data are there, and these are multimodal data. So there is a need for methods which can actually make use of all this data and then help them to make a decision, right? But again, the multimodal data alone is not going to be helpful or sufficient, not helpful, like sufficient, and we might have to go for federated learning. Now the challenge comes here is that, okay, although they have multimodal data, but all of them may not be present in every centers because they might go into the different pathway of making diagnosis or so on. So in this case, our objective was, okay, so how can we design a federated learning method which can handle actually the data with multimodal data with missing modalities, right? So the modalities here that we consider is X-ray, the radiology scan, and the clinical findings here, okay? Right, so these are the three different combinations that can be present because there are only two modalities, and if we consider three, then 2 to the power 3, and so on. So different combinations can exist, right? So idea is our solution. So this, as we presented this year, in MICAI. MICAI is a top conferences in medical imaging. So here, the idea, I mean, again, like not going into the details, maybe it may not be like not really interesting for many people here, but the idea here is like we came up with some kind of novel technique called, yeah, one of our speakers has mentioned it, RAG. So we use this retrieval augmented generation kind of technique to complement the machine modality, and then use them to, you know, train a model in a federated manner, right? So again, here from our method, the performance has been substantially improved. These numbers, bolded numbers, means again the better, and the last column shows our performance here. Right. So this was about multimodality. So do I still have time, or really? Then I think I'm quick. Right. I'll leave time to the next speaker maybe. So that's what all about federated learning here. Right. So then my team is actively invested in developing novel algorithms to address some of the problems still that exist in federated learning here. So our future direction is enhancing the security, so basically encrypting the model and the parameters, because the model itself, when we share, you know, there can be some attacks that can disclose chances. The chances of disclosing the patient information is still there. And scalability means like we want to make a system that can scale up to, let's say, hundreds or thousands of clients. So far, the algorithms that exist so far, they can scale up to 100. But if we want to go like globally, like, you know, the institution from the globe, they want to collaborate in a certain, to tackle a specific disease. Let's say, for example, genomics, something related to genomics, right? Because genomics, genetics, they are related to the number of people that every country has, right? Even if we want, I mean, the population in Nepal is 30 million, so we can't have more than 30 million genetics. So meaning like there are certain problems where we really need to, you know, collaborate. Then, so we want to address such problem by making a system like which can like scalable, and hundreds and thousands of institutions can participate. And another thing, self-governing, like meaning like if there are n numbers, like large number of the institutions they want to participate, then there can be also the chances that there can be some malicious attacks, right? We can't really check all the, like basically verify all the institutions participating clients, you know, their credibility. So we want to come up with some idea to, you know, detect such malicious attacks and prevent the network, this federated learning attacks, right? And definitely these things are there, but real world implementation is still lacking, I guess. It's to the best of my knowledge, because we do this experiment in the lab in a simulated environment, but this real world implementations can still bring some new challenges, and if there are any, I think with the implementation of this technology, there can be more challenges, new challenges, and then we'd also like to tackle such challenges in the future. And thank you so much for your attention.